Where knowledge meets compassion, mentorship begins.
Before anything else, let us show you our poster for this research study.
Great nurses aren't born. They are nurtured through mentorship where guidance transforms potential into expertise and passion into compassionate care. G'day! We are the Group 3B from B and 3A, presenting our research entitled Lived Experience of Clinical Mentorship in Developing Clinical Skills and Confidence Among Nursing Students. I am Marisha, joined by my groupmates Melgar, Merabe, Mombay, and Oliveres. And now, let us explore the background and rationale for why this topic is not just relevant, but essential in nursing education.
Effective nursing education is built and thrives greatly on the mentoring relationship between nursing students and their clinical instructors, especially in the context of clinical exposures where theoretical knowledge is applied to real-world situations.
This study aimed to explore the lived experience of clinical mentorship in developing clinical skills and confidence among nursing students. This research study may be significant to the following sectors: for policymakers, Department of Health, university administrators, hospital administrators, nursing educators, nursing faculty, nursing students, and finally, for future researchers.
And for our theoretical framework, our study is grounded in Patricia Benner's novice to expert theory, as it highlights the progression of nursing students from novice to advanced beginner, emphasizing the crucial role of mentorship in supporting their confidence, critical thinking, and transition from rule-based learning to intuitive and competent practice.
The study's conceptual framework draws on the Benner's novice to expert theory, which highlights observational learning and self-efficacy. The diagram systematically connects the essential elements of the study, illustrating how participant characteristics relate to their lived experiences with faculty mentorship and how these experiences subsequently influence their clinical skills and confidence.
In this study, the type of research is a qualitative phenomenological design, where collection of data came through semi-structured interviews, allowing participants to freely express their experiences. Using then managed hermeneutic phenomenological approach, focusing on identifying themes related to mentorship, feedback quality, and support in the faculty-student relationship. Furthermore, it was ensured through in-depth interviews, member checking, and the focus on capturing participants' experiences accurately.
Now let's discuss the participants of the study. We included a sample size of 10 nursing students by using the propulsive sampling method. The inclusion criteria for this study are as follows. Participants are nursing students aged 20 to 22 years old, enrolled in level 3 or 4 during the first semester of academic year 2024 to 2025, with 5 participants selected from level 3 and 5 from level 4. They completed OP ward and medical surgical ward exposures. The exclusion criteria apply to students younger than 20 or older than 22 years old, students in level 1 or 2 or with those with no exposures in specified areas, and lastly, students not enrolled in the first semester of academic year 2024 to 2025. Participants were conducted via social media and choose their own pseudonyms to ensure confidentiality and autonomy, fostering rapport and informed consent.
For the research instrument, a semi-structured interview guide was used. It was evaluated by the University and College of Nursing Guidance Counselors. The guide had 3 parts: demographics, the overarching question, what is your lived experience on clinical mentorship in developing clinical skills and confidence, and open-ended questions on mentorship experiences, skill development, mentoring strategies, and suggestions for improvement.
For the data gathering procedure, propulsive sampling selected qualified nursing students assigned to various duties. Participants were informed about the study, signed consent forms, and were interviewed for 30 to 45 minutes between January and March 2025 based on their availability. Interviews took place in a reserved university library room, beginning with informal questions to build rapport. All sessions were recorded and summarized to ensure accuracy with privacy and confidentiality strictly maintained.
Ethical considerations were strictly followed to protect participants' dignity and confidentiality. Approved by the university's ethics officer, the study upheld respect, autonomy, beneficence, non-maleficence, and justice. Participants chose pseudonyms, and data protected under RA 10173 was stored in password-protected files for disposal after 3 years. All interactions maintained confidentiality, respect, and integrity. And this is the simulacrum of the study. For the results and discussion, we have identified 5 themes with 3 sub-themes each. The first theme we have is the relevance of faculty-student mentorship in clinical learning. This highlights the important role of CIs in building students' confidence, competence, and professional growth as they move from the classroom to clinical settings. The first theme is the nature of faculty-student interaction. This shows that supportive, approachable CIs boost students' confidence and motivation, while a lack of encouragement can create fear and hinder learning. The second sub-theme is communication and feedback. This highlights the importance of clear, supportive feedback. Participants share that even negative feedback, when given well, helps them improve, build confidence, and feel safe to learn. And lastly, the third sub-theme is role modeling and professionalism. This highlights that CIs serve as both instructors and role models. Demonstrating procedures and guiding practice builds competence, encourages questions, and promotes a professional attitude.
The second theme, we have effective mentoring strategies. This theme emphasizes how structured guidance, supportive feedback, and adaptability are crucial in shaping confident nursing students. The first sub-theme, we have step-by-step instruction. Participants shared the clear step-by-step teaching, such as during OTF administration and emergency situations. Reduce their anxiety, allowed them to master complex procedures more easily. The second sub-theme, we have constructive feedback. Participants emphasize that immediate and composed feedback from clinical instructors during high-pressure tasks like CPR corrected their techniques in real time, helped them manage stress, boosted their confidence. The third sub-theme, we have adaptability to student needs. Participants appreciated clinical instructors who adapted their teaching methods to individual learning needs, fostering greater clinical competence, resilience, and readiness for professional nursing practice.
Third theme is emotional and psychological impact on mentorship. CIs influence both technical and emotional development of studying nurses, how they handle stress, build confidence, and turn into capable practitioners. The first sub-theme is strictness versus supportiveness. Students prefer CIs who balance being supportive and allowing independence. The second sub-theme, fear of mistakes and high-stress procedures. Encouraging feedback during high-pressure tasks helps students stay focused and perform better, while harshness leads to errors and blows self-confidence. Lastly, the third sub-theme, confidence development over time. As students gain more clinical experience, their confidence grows, especially when CIs progressively trust them with responsibility while support remains.
The fourth theme is challenges in clinical mentorship. This theme highlights issues that affected students' learning. The first sub-theme is limited supervision in some procedures, as it caused anxiety among students who emphasize the need for proper guidance, especially for first-time procedures. Next, the second sub-theme is varying teaching approaches among clinical instructors. It showed that inconsistent mentoring styles from supportive to strict impacted their confidence and learning. And lastly, the third sub-theme is lack of personalized mentorship, wherein it reflected students' desire for more individualized support to match their unique needs and learning styles.
For the fifth theme, which is the recommendations for improving clinical mentorship. So this theme highlights ways to strengthen clinical mentorship based on student feedback. The first sub-theme, which is opportunities for independent practice, the students stress the need for more hands-on experience and greater trust from instructors, encouraging more autonomy as they advance. The second sub-theme, which is the standardized mentorship approaches, so the students called for consistent, supportive mentorship tailored to different learning styles with clear communication among mentors. The third sub-theme, which is the encouraging a positive learning environment, a calm, supportive approach from clinical instructors was viewed as crucial for boosting students' confidence, especially under pressure. Students also recommend two-way feedback and involving staff nurses to strengthen mentorship.
And for our study's conclusion, the findings reveal that clinical mentorship significantly enhances nursing students' practical skills, critical thinking, and emotional readiness. Positive mentorship characterized by trust, feedback, and empathy was shown to ease anxiety and support learning, while inconsistent or unsupportive mentorship resulted in self-doubt and hesitation. Notably, the students' academic standing influenced their initial confidence, but mentorship was the equalizer that fostered growth across all performance levels. The study concludes that mentorship is not merely an academic supplement, but a transformative element of clinical education. By fostering a supportive, consistent, and intentional mentorship environment, nursing programs can empower students to become competent, confident, and compassionate professionals. These findings advocate for mentorship to be institutionalized as a core pillar of nursing education.
The results of the study is recommended to DOH, University Administration, Hospital Administration, nursing educators, nursing faculty, nursing students, and lastly, for the future researchers. For references, just scan the QR code flash on the screen.
1.
And lastly, the researchers would like to thank the following: our Almighty God, University of St. Lasal College of Nursing, our dear participants, Dr. Shiella M. Trajera and Dr. Leslie E. Young, our ANRES RLE facilitator and advisor, our dear panel of evaluators, and lastly to the researchers, families, and friends.
From no listeners, guided to greatness.